So today's session is the beginning of a new section of discussions about lower urinary tract disease. So the next 4 weeks are all focused on lower urinary tract disease in cats, which is an important area for us as carers and as clinicians to know about. It's a reasonably common situation that we're presented with in our clinics, cats suffering from urinary problems. So the plan for today is to look through these issues. We're going to look firstly at some definitions. So what is the lower urinary tract and what are some of the important medical definitions relating to this? We're also then going to look at what the common causes of lower urinary tract disease are, and these do vary a little bit actually according to the age of cats. So I would like to point out some important differences in terms of the frequency of some of the diagnoses we make in younger compared to older cats. And then we'll talk about what sort of clues you might see in your cat as an indication that it has lower urinary tract disease, and which of these are perhaps more concerning than others. And lastly, really, I will just very briefly give an overview of how, as a vet, we make a confirmed diagnosis of the cause of lower urinary tract disease that we're dealing with. So that's the broad brush plan for today. And the first thing really I think to explain would be, well, what is the lower urinary tract? And the lower urinary tract is the bladder, which is where urine is stored, and the urethra, which is the tube taking the urine from the bladder to the outside. And I've put up an x-ray here. It's a cat lying on its side. So imagine that your cat's lying on their side and you're standing above it, looking down. And just to annotate it a little bit now, you can see some of the bones that show up white on an x-ray. I've now labeled. So we've got the backbone, the spinal column at the top of the image, the tail. To the right, it's standard to show x-rays with the cat's head on the left-hand side of the image and the tail on the right-hand side. We then have the back leg. You can see both of the back legs superimposed, and then a little bit, I've not shown the whole of the abdomen, but a little bit of the abdomen, including, in this poor cat's case, a very large bladder. This bladder is much fuller than it should be because this cat was having difficulty passing urine. And I've also labelled that you can see where a kidney is as well. So from a lower urinary tract disease perspective, we're talking about conditions that affect the bladder and the urethra. And the urethra is the tube that takes urine from the bladder where it's stored to the outside. So in a female cat, the urethra is quite short. In a male cat, it's longer and also can be narrower. Other important definitions I've put on this slide are lower urinary tract disease, which is basically any illness affecting the lower urinary tract. And lastly, cystitis, which you'll be very familiar with as a term that we use in ourselves. Cystitis means inflammation of the bladder. So can occur for a number of reasons. It's just a very broad brush term that we use. Some other definitions that are helpful to know at this point. Well, next week we're going to talk a lot about idiopathic cystitis, FIC. Feline idiopathic cystitis is probably overall the very, very most common cause of lower urinary tract disease in cats. So if any of you have had a cat with lower urinary tract disease, you will have probably heard of this diagnosis because it is so common. Idiopathic means cause unknown. So it's the sort of posh medical term, if you like, for saying we actually don't know what the answer is here. And sometimes people will call it stress cystitis because it's often linked to stress. Stress is certainly thought to be something that exacerbates and can actually precipitate episodes of this idiopathic cystitis. I'm going to also talk about obstructive disease of the urinary tract. Obstructive means blockages. So again, some of you may have had this experience with your cats, and this is really one of the worst situations to experience in terms of lower urinary tract disease, because if you have a cat that is blocked, where there is obstruction to the passage of urine from the bladder to the outside, that is extremely serious. It can actually be rapidly fatal. So this is definitely something we don't want to see if at all possible, but including the term obviously at this point to explain that to you. And then last on this slide, I've got urolithiasis. Urolithiasis means that there are stones in the urinary tract, and actually they can be often the bladder, that's the most common location, but they can occur in the kidneys, where they would be called nephroliths. That would be another situation. In the ureter, which is the tube from the kidneys to the bladder, and ureterolith would be the term there, or they can block in the urethra, the tube from the bladder to the outside. So, and that's one important cause of blocked cats. And then we have last few definitions here. So crystals, you again will probably, if you've had a cat with urinary tract disease, you may have heard your vets, or you may have read about crystals in terms of their relevance in this situation. They are microscopic, so we can't see crystals with the naked eye. We look at them under the microscope, and this is the picture on the right is what's the most common sort of urine crystal, which is called struvite, or magnesium ammonium phosphate crystals look like under the microscope. So they're not visible to the naked eye. And in fact, if you have a cat that eats any dry food, or if there is a delay in the analysis of a urine sample, you pretty much always will see some struvite crystals. So they can be completely normal and completely irrelevant, but in some situations they can be significant. For example, some types of crystal are associated with certain conditions, and also for the urinary blockage situations, you can get these plugs, which is another definition on this slide, which are a combination of protein and mucus and crystals, which form a bit like a cork in a wine bottle. They form a plug which can block the urethra, and in that situation, crystal management, as it were, in terms of a treatment plan, can be an important part of treatment for a particular cat. And then lastly, just to complete the definitions here, a reminder that what I may call a tumour or a neoplasm, or refer to neoplasia, this is all in terms of cancer. So cancer diagnosis and management, which again, obviously we hope we don't see too much. And actually it's not that common in terms of urinary tract disease in cats. So what does cause lower urinary tract disease in cats? What are the important causes of lower urinary tract disease? Well, as I mentioned a little bit earlier on, there are some differences in terms of the important causes according to the age of the cat. So if we start off by actually looking at cats under the age of 10, which are actually the cats that we probably most often see presented with urinary tract problems, then this would be a very rough breakdown of the causes and their frequency. So you can see top of the list is this idiopathic lower urinary tract disease. This cause unknown, although we'll talk more about that next week. There is lots known about it, although overall we still don't know all of the answers. But this probably accounts for possibly a half to 3/4 of all cats under the age of 10 presenting with lower urinary tract signs. So it is, if your cat has episodes of urinary tract problems, this is definitely a really important thing that your vet clinic will be very much considering as a possibility. Other possibilities overall would include stones. So if you have stones in the bladder, of course, they cause irritation. That can make your cat have cystitis as a result of the irritation from those stones. Urethral plugs, we mentioned a little bit, those are relevant in terms of blocking the urethra, so relevant in your blocked cats. But this slide just covers the overall situation for our cats under the age of 10. And infections, you'll see, actually are quite infrequent as a cause of lower urinary tract disease in our younger cats. So bacterial cystitis is actually relatively uncommon in a young cat, or that's certainly our current thinking. There are some other causes which are really also quite rare, so less than 10% of cases overall. That would include things like trauma, so perhaps a road traffic accident causing urinary problems, perhaps some congenital problems, problems that the cat may be born with, for example, incontinence, or problems with the development of the urinary system. And also cancers, which in young cats, cats under the age of 10, relatively infrequent as well. The next category of cats I wanted to highlight the differences with was our blocked cats. So these are the cats where there is a blockage, they can't pass the urine through their urinary tract, and the bladder therefore becomes very distended. And this is very life-threatening, because if the urine contains all these toxic products that are needed to be excreted from the body, and if they can't be excreted, they build up, and that can very rapidly really cause very dangerous changes in the body. And those, perhaps not a surprise to find, that blockages are often caused by physical things, so stones, also plugs, sometimes blood clots. So if your cat has a sort of very bloody cystitis, a blood clot could actually cause a blockage as well. But stones and plugs would be the biggest category. And then lastly, we've got the older cats to consider. So this is the breakdown for our older cats. And the big thing you'll see here is that infections become much more likely, almost 50% of the time, in terms of our approximate data that we have at the moment, would be due to an infection. And we do know that certain illnesses, kidney disease, hypothyroidism, diabetes mellitus, seem to predispose our cats to bacterial lower urinary tract infections as well, so increase the risk of this happening. So if you do have an older cat and it develops lower urinary tract signs, a really big contender as a possibility would be bacterial urinary tract infection, UTI, and in particular if they do have one of these other underlying diseases. What signs might you see as a carer if your cat has lower urinary tract disease? Well, probably if you've ever suffered from cystitis yourself, you will know many of these signs yourself. So it could be difficulty passing urine, it could be pain passing urine, so your cat may cry out, may repeatedly need to use the litter box, or repeatedly strain in inappropriate locations. You can see this picture here. This is a patient of mine with a very horrible cystitis, and you can see actually there is a litter box available for the cat, but he was so uncomfortable, he just was squatting and straining all the time, and what he was passing was quite bloody. There may sometimes also be a change to the odor of the urine. It can be very smelly if there's an infection, for example. And as a sign of discomfort, cats can obviously be quite grumpy and irritable, unhappy. They may be depressed, all these things that you would expect if you too were suffering from low urinary tract signs yourself. And for some cats, as part of their way of trying to cope with that pain, they will overgroom and sometimes pluck the fur from their belly over where the bladder is, perhaps trying to take away some of that painful sensation that they're experiencing. If you see your cat straining and it's not passing even a drop of urine, then that is very worrying. And that's the situation where, in particular, we need to worry about the cat having this urethral obstruction, being a blocked cat. And that, as I've already said a few times, is really a life and death emergency. It's not the sort of medical illness to hesitate in any way before contacting your vets. And they will always want to see you if you say, I think my cat is straining and not able to pass urine. That is absolutely 10 out of 10 a medical emergency. So if in doubt, pick up the phone, speak to your vets, even at the moment if you know that access to vet services is still a little bit limited by the current COVID situation we're in. This is absolutely a very definite medical emergency which your vet clinic will want to know about should you suspect it. And equally, if you can see your cat is not well, if they are not eating, they're not themselves, then that's another reason to really push that emergency button. I wanted to also mention a couple of other things that are linked to the urinary tract. So one of them is spraying. I'm going to talk more about what is often in the vet world called inappropriate urination. It's actually not a very good term. Means urinating outside the litter box in a later session in this series. I think it's the third week, possibly the fourth week, that we talk about this. But spraying is another well, it's not abnormal necessarily for the cat, but for us, something that we might not want to see in our house is where a cat is urine spraying, typically against a vertical surface, so a wall, a door, or some curtains. And this is a scent marking process, which tends to therefore be more commonly shown by entire male cats as part of their territorial marking, but sometimes will occur inside the home, again, usually because of some stress in terms of perhaps relationships with other cats in the home and this desire to show some territorial marking. So it does, of course, involve the urinary tract because urine is being sprayed, but perhaps not a disease in the way that many of the other things I've mentioned are. Inappropriate urination, periuria, urination outside the litter box, is also something that we can see very much linked with lower urinary tract disease. If the cat has cystitis and it's just so desperate to constantly be straining and trying to pass urine and doesn't always manage to make it to the litter box, then of course we may see urination outside the litter box, and that could be on the carpet, it could be on your bed or on other soft furnishings. And certainly if the cat has time to make a choice, often they will choose somewhere that is quite soft, and duvets on beds are very popular, but other soft furnishings also are popular as well. And a number of reasons why cats might do this. Again, we'll have a specific session about this, but some examples listed on this slide. So it is very definitely cats with lower urinary tract disease, but also if your cat has arthritis, for example, and it can no longer get into its litter box or no longer comfortably get through the cat flap to get into the garden, then they may start to pass urine in what we would consider an inappropriate location. From the cat's perspective, it might actually suit it fine. It's the cat may not mind urinating on our bed, but of course from our perspective that's not something that's going to go down very well. But we'll talk more about that in the later session that we have planned for this. So how are we as vets going to diagnose lower urinary tract disease in cats, and when is that really a priority? Well, you will sometimes have a situation where a cat will literally have one episode of urinary tract signs, and perhaps they will pass. 24 hours later, everything seems back to normal. And if that's the case, and it genuinely stays back to normal, then you don't necessarily, of course, need to do tests and investigations to work out what happened, because it has sort of self-cured, if you like. But for those situations where the clinical signs are persistent or prolonged, or episodes keep recurring, then of course doing investigations becomes really important to try and work out what is the cause so we can find the best treatment. And the other situation, of course, where investigations are really important would be those cats that we suspect to have that urethral obstruction, the blocked cat, and the cat that's ill. All of those situations definitely are ones that your vet clinic would want to be involved with. So where veterinary involvement is required, the steps that are taken, the steps that we take, would include firstly what we call taking a history. So a medical history is where we ask lots of questions and we gather some information that really builds hopefully as detailed a picture as possible that helps to tell us what might be the cause of the problem. So we would want to know, for example, is this the first time this has happened, or do we have an underlying problem that has come back again, or perhaps has this cat got underlying diseases like kidney disease or thyroid disease that may have predisposed it to a urinary tract infection? Is the cat able to pass urine to your knowledge at home? And you might not always be able to say. It's not always easy, but if you can say, clearly that is useful information for us to know. Are there other signs? Are there other clues? It's all about really trying to gather as much data, a bit like a detective solving a mystery. We want to get as many pieces of that jigsaw puzzle as we can to try and provide the best solution. And given that actually many cases of lower urinary tract disease are this idiopathic cystitis or stress cystitis that I've mentioned, often what we would call a behavioural history is also really helpful. And this is where we, as well as the medical information, gather data about life at home for the cat. So how big is the house? Does the cat go outside? Are there other cats in the house? Do they get on with each other? Are there known situations of tension in the house? Any changes in the house that might explain the cat feeling unsettled and showing these signs? So not necessary to always go into this much detail, but certainly again with those more persistent or recurrent cases, actually looking in detail at the behavioural background can be very helpful, because if we find areas where we think there is some tension or some conflict, then there may be a solution that we can use to support that. And I'll talk more about that next week in the idiopathic cystitis session. There are lots and lots of things that can stress out our cats, and this is definitely not an exhaustive list, but just for illustration, this is a list of some of the most common causes of stress in cats that may result in lower urinary tract signs if they are vulnerable to those. So having the builder in, putting down a new patio that covers the cat's favourite bit of the garden, new neighbours with a new cat, new babies, all these sorts of things have the potential to upset our cat's equilibrium and potentially cause or exacerbate urinary problems. Beyond that, next steps that we'll want to take, well, certainly as a clinician, will be to examine our patients and see if there are clues that we can glean on examination that will help to tell us whether, again, we're dealing with an idiopathic disease or whether there are other clues that take us in a different direction. So what is the bladder size as well? Is the cat able to empty the bladder completely, which is normal, of course, or is the cat having difficulty emptying the bladder, which is much more concerning? Is there any dehydration or other changes there that may need more urgent action? So ideally, of course, an examination is the next step. And even in the current restrictions that many of us are facing due to the COVID situation, again, if your cat has these sorts of signs, your vets will almost certainly be able to examine them. It will just be a slightly different experience for you, because probably you won't be allowed to accompany your cat into the clinic, or certainly that's typical at the moment. And then after that, other tests that of course may be helpful, well, a key one, think of the urinary tract, is obviously analysis of a urine sample, because, for example, if there is a bacterial infection, then collecting a urine sample, sending that to a laboratory, culturing the bacteria, and also determining what antibiotics are likely to be most effective. All of these things are going to really help us to be able to provide the best treatment for your cat. There are other clues that we can get on our urinalysis as well. So how concentrated or dilute the urine sample is, for example, whether there is blood in the sample or other abnormalities on our sediment. Are there unusual crystals, for example, or a lot of crystals that worry us? So there are all sorts of things that we can get information from, Probably one of the biggest challenges, unfortunately, is that in cats with cystitis, if they are able to urinate, they often will be urinating very frequently, and it can be very difficult to actually get a urine sample, as you might imagine, because every time there's a little bit of urine in the bladder, the cat desperately pees it because they feel so uncomfortable. So that can be a challenge, and sometimes it's not possible to as readily collect a urine sample as we would like, but certainly where at all possible, that's really, really useful. Blood tests often are not actually that helpful for cats with urinary tract problems. They're definitely important in those cats that are unwell, particularly those cats where urethral obstruction, the blocked cat situation, is suspected, because there can be quite severe changes that we find on our blood screens, which we can correct, which we can treat and stabilize the cat. For example, potassium levels can go very, very high in our blocked cats, and their acid base balance, their blood acidity, can also be knocked off, and again we can help those. So that's one example of where the blood tests are useful. But for example, with a cat with idiopathic cystitis, often the blood tests are not specifically that helpful. There aren't changes on the blood panel that are either diagnostic or useful for us to look at. So a little bit of a mixed bag there in terms of utility of blood tests. Beyond that, the next useful thing to do is imaging. So imaging means using x-rays, ultrasound, possibly other imaging modalities, CT, MRI, all exist in the vet world as well, but often it's ultrasound and x-rays that we use most frequently. And actually ultrasounding the bladder is quite easy. The bladder is usually quite easy to find and easy to see. Urine shows up black on an ultrasound scan because it's a fluid. And this ultrasound image on the left-hand side of the slide shows a little stone you can see in the cat's bladder. So it can be a very helpful way of spotting problems. We can't, unfortunately, ultrasound the urethra, the tube from the bladder to the outside, because of other structures in the way. So if we suspect a problem there, ultrasound is a little bit limited. X-rays can be much more helpful for that. And the picture on the right-hand side is an X-ray image which shows a contrast study being done in this cat. And the contrast is an iodine-based contrast which shows up bright white on an X-ray. So you can now see some filling of the bladder, but you can also see the tube going from the bladder towards the pelvis, through the pelvis. That's the cat's urethra showing up on the X-ray. So if you have a problem with the urethra, such as narrowing, a stricture, or if there is a prostate problem, which is rare in cats but does happen, these sorts of studies can be really useful in finding that. And indeed, in this cat, you can probably appreciate that the contrast material filling the bladder looks a little bit irregular, particularly on the sort of upper surface, because the cat's bladder was thickened in an irregular sort of way. And normally that contrast should look like a white balloon. It should be quite a smooth balloon, and you can see it's a bit rough on the upper and sort of left edges of that. So imaging certainly can be useful in terms of gathering more data. Beyond that, there are some other tests which occasionally are available and can be helpful. Again, some of these are quite challenging in cats. So cystoscopy is actually using a small fibre optic device to, or small camera, to essentially look up inside the bladder, but that is something that often is limited by the size of the cat, and even in a large cat can be quite difficult to get a small enough device to look up there. But particularly some of the big referral centres will have access to cystoscopy, and for female cats it's a bit easier because their urethra is a little bit larger than the male cats, so it can be useful to look inside there. And in some situations, it can be helpful to collect a sample of the bladder wall, so a biopsy for looking at under the microscope, and even potentially doing a bacterial culture on as well. So there are occasionally these sorts of tests are helpful to do, but the bulk of cases are managed with the tests that I talked about earlier. So imaging and urine testing being the big ones that are often very, very helpful. So that really completes today's discussion on causes of lower urinary tract disease and an introduction to this topic. My summary would be that this is a fairly common condition in cats of all ages, but the causes very much differ according to the age of cats. So in young and middle-aged cats, idiopathic disease is very, very common. This often stress-related disease we'll talk about next week. But in older cats, often bacterial infections become more likely. So a completely different sort of treatment required for these cats, and the older cats you would want to understand whether they have underlying disease that has precipitated that problem. Stress, because it's so important, really dedicates well, more than one presentation on it, but next week that will be a big part of it, really looking at what factors in the home can influence a cat and can exacerbate cystitis in particular. And of course, the idea from today's session is really to introduce you to the topic and emphasize that the best treatment, of course, comes having made the correct diagnosis. So in those cases that are persistent or recurrent signs, that's why doing these tests is so important. So we make sure that the long-term plan fits best with whatever's wrong with the cat. So to conclude, I'll just remind you of some useful resources on the website. So we do have one of our book titles relates to this topic. So Caring for a Cat with Lower Urinary Tract Disease is one of the Caring for Cats series of books. And this one was written by myself and Professor Danielle Gilmore of the University of Edinburgh, and is designed to be supportive to anyone who's had a cat with lower urinary tract disease in terms of explaining, as I've done today, what the causes are, but also management. So it really includes everything that I'm talking about in this presentation of in this series of webinars, but you might find helpful as an additional resource for you. So that's in the book section of the website, and also a reminder that I do offer telephone referrals. So if you have a cat with urinary problems or other feline internal medicine problems where you're finding it's difficult to make the progress or get the outcome that you're looking for, then please do bear that in mind as a possibility, and there is information on that on the website as well. So thank you very much again for choosing to listen to this afternoon's session. I do hope that you found it helpful.